or at any point during the sort of question and answer session, please feel free to put them in the chat box. And if you've got any questions at the end, I'll also be putting them to Maureen as well. So that's probably enough for me chatting at the moment. So apologise for rabbiting on. I was just trying to put the record function on, so that was why I was a bit distracted, Jansen. So okay. So without further ado, I will now hand over to our presenter. A very warm welcome to Maureen, who is the Director of Faith in Older People, and she'll do a presentation, and then I'll come back to you at the end to tell you and ask any questions that people have got. So I'll hand you over to Maureen. And I'll put up your presentation, I think, Maureen. So,
thank you very much, Brian, and thank you very much to you and Hourglass for inviting me to make this presentation around spiritual care matters for older people, because that's our focus. But spiritual care matters to most of us in different ways. So when we think about spiritual care, it's about how our spirit helps us to function and gives us enthusiasm. And it's been around for a very long time, and it's been important for a very long time. The Egyptians had a focus on our spirit, as did Plato. But the focus has changed through the centuries. It's gone through a theological approach, into a philosophical perceptions, and now into perhaps a more secular idea of spiritual care. We can't ignore it. We talk about it, and we talk about a spirited person, a person in good spirits. So what does this mean for you? It's a big topic, but it's absolutely fundamental to our well-being and our sense of ourselves. I've been thinking about spiritual care during the pandemic, and I wondered whether you felt that people were more aware of its importance because of the pandemic, and because those who've cared for people in hospital and care homes and in their own homes have been more conscious because of a lot more death and dying issues to focus on, that spiritual care has become much more important. So I wondered whether you had a reflection that you might want to put on that. Throughout the presentation, I'm probably going to pose a few questions. So please do come back about them. They're there to stimulate discussion. In no way do I feel I've got all the answers, because there's a myriad of resources out there which I would encourage people to use, and we'll come back to some resources at the end. But perhaps a little bit about Faith in Older People to start with. We're a very small organisation. We're a voluntary organisation, and our origins were with an Episcopal minister who felt that older people often got marginalised if they no longer were able to attend their church, and that it was really important that we followed them wherever they were, in their own home, in hospital or a care home, and that their spiritual lives should be continued wherever they were. So we're not a religious organisation. We work with those of faith and none, and we want to support people in terms of understanding what their spiritual needs might be, and encouraging those of us who provide care in whatever capacity to begin to think about how those needs can be met. As you can see, there's only two of us. We're both part-time. And so we involve a lot of very experienced and skilled associates, which make a huge difference to us. But we really work on the basis of collaboration with faith communities, with academics, with chaplains, with staff in the NHS and care homes and the voluntary sector. And I'm sure I've left somebody out, people out, but we're very grateful for the experience and expertise they bring to us. So examples of the work we do: we produced a dementia resource for faith communities to build confidence and competence, and to ensure that people were comfortable supporting people who experienced or were affected by dementia. It's been very well received, and we're very pleased to get a comment from Canada that it was an awesome resource, which certainly boosted my spirits on that day. We have done a lot of research into how care homes understand spiritual care, and I'll come back to some of that research. And we've also done similar research in long stay hospitals in the NHS. And currently we've just finished a research project for NHS education, which has looked at the education of nurses in our Scottish universities, and some of the issues that were raised in that I'll come back to. But it also, I think, is important to consider social care staff who are trained within our colleges of further education who do SVQs, because there's an element of spiritual care education within those courses as well. So we run events, we have major conferences, we do articles, and most importantly, I think we want to be a positive resource for people involved in spiritual care. So we have I hope, a good website that includes a lot of background research, policy, and so on. And we use our newsletter to disseminate a lot of this information. Next slide, please. So how do we define spiritual care? I mean, there's a lot of different definitions, and it's really important we look at them. But what's really important is fundamental to all of them is meaning and purpose. What matters to somebody? How do they express it? What gives that day-to-day meaning to people's life? And I think I really like the Froggatt and Moffat one about zest and energy as well as identity. But I think it's also important that we look at spiritual care in the second context, about how people use their sense of spirituality to support them through trauma and ill health and sadness. And in line with that, it's how we turn to friendship and comfort in terms of moving forward. There's always debate about spiritual care and what does it mean. The language we use to express it, and how do we use it to express what we need for ourselves? Do you give your spiritual care or your spiritual well-being attention? And does it have a specific meaning for you? Because that's really important. It's different for all of us. So I can't make an assumption about the care that you would like. I need to spend time finding out what is the care that you need. What would make you feel your spirits rise? And that's very important. So it's about the individual. And certainly throughout our experience of person-centered care, it's always about looking at the individual. Next slide, please. Thank you. Back. Sorry, that's it. So why does spiritual care matter? As the WHO has pointed out, it's not just not being ill, it's a whole integrated state that comforts us, gives us the energy that helps to sustain us through our lives. It's really important. And I think of those four things as the sort of cornerstones of how we build our resilience to things. There's an interdependence that is really, really important that makes good person-centered care happen. For us, if we care for someone, it's about noticing and attending quite carefully to what's important for that individual. It shouldn't be seen as an extra task, but how we do things. And so the issues that care staff have raised with us about, does it take a lot more time? Yes, it does, if you do it well, but it's not just more time, it's how you use that time. How do you really listen to someone and pay attention to them? I think the word that's often used is really attending to what the person is saying. And one of the illustrations from the research that we did was one staff member called it, for her, It was the sink moment when she was helping a resident to wash. And in that ordinary, everyday opportunity to talk to someone, they weren't doing anything special. They weren't doing anything that required the individual to answer questions and for it to be intrusive. It was a moment that the resident could bring up an issue that really mattered to them, their concern about the future, their sense of being alone because a family member couldn't visit. It's that moment that we really need to catch hold of, and that so we don't lose it and we attend to what that person is wanting. That's a time element, but it's also a practical element too that one can take forward. It's also how we elicit from an individual what raises the spirit. And we've done quite a lot of work with people who are affected by dementia, and it's not easy to do that, but we can find out from them and we can observe what makes things really important for them, what makes them smile, and so on. So is it music? And do we know what music people like? Is it the opportunity to continue knitting, even if all the stitches drop off? It doesn't matter. Or is it being outside? I have a friend who says if she's ever admitted to a care home, she will have it tattooed on her chest that I need to go out in the fresh air every day. That will help to sustain me. It's really important that I feel the wind on my face and I go out every day, as well as a cup of tea, she said. But the playlist for life is really important because that has often been found to have a good calming effect, engaging people and so on. So there are lots of aids and tools that we can use to help elicit what matters to someone and what raises their spirits, what makes them the spiritual well-being even more important for them. But fundamentally, we need to know the person's story, because that will tell us much more about who they are and through their life, what has mattered. And I think we need to find ways of doing that. One of the things that Faith in Older People did was to undertake a project called the Purple Bicycle Project, which was formulated by Professor John Swinton in Aberdeen University and Dr. Harriet Mowat. And it was a technique for building those stories by bringing together a key worker in the care home, the individual, and a family member or a friend who could start to piece together those important elements of someone's life and the difference that understanding them would make to their future. So there are ways of doing it. And so I emphasize story is really important to understand the spiritual dimension in people's lives. You don't have to be in a care home. I think we should do it in our families. I think we should do it in congregations much, much more than we currently do. So that's a way of working. And having a focus on the spiritual dimension, I think, gives an opportunity for people to talk about end of life and dying. And it's something that we as carers, as family members, need to feel more comfortable about so that the person can talk about them. I think very often as children, we don't want to acknowledge, mum is going to die. So we don't really want to talk about it. So we don't let her talk about it. And it's very difficult. But the important thing is mum or auntie or friend actually needs to address that. So we need to feel competent in the spiritual well-being of enabling that to happen. Malcolm Goldsmith, who founded our organization, said it was really important for people to know who will hold my soul, who will remember me when I don't really know myself anymore, or when I die. And I think remembering that is very important if we want to focus on somebody's spiritual care. Next slide, please. So why does spiritual care matter? Can we move to the next slide? So we often, I think, get caught up with spiritual care and religious care, and people feel very confused about it. And sometimes the language and the definitions get in the way of us acknowledging, what it's about. This explanation is taken from Spiritual Care Matters, which was produced by NHS Education in 2007, and it's used by the chaplains and others up to the present time. And I think it's a good way of looking at it. It's simple because it defines the wider sense of spiritual care and the religious element, but differentiates them, as the final statement it suggests, that spiritual care is always there, but not necessarily of religion, but religious care should always be spiritual. So I think it's a really important distinctions that I recommend to you, because I think it takes away some of those barriers. Because defining spiritual care is often seen as a barrier. And if somebody's immediate reaction is, oh, it's about religion and I don't do religion, then actually what you're doing is not allowing somebody else to express what really matters to them, even if you're not religious, because it's not about you, it's about them. And it's about that enabling, that compassion that we want to take to care. And we must acknowledge that for some, religion is actually a really important cornerstone for them in terms of supporting them through very difficult times, and has been throughout their lives. It's, when I visited care homes and been there when they've had a worship session, or when the chaplain or the ministers come, to see that people are fully aware of the importance of why that person is there is really important to appreciate and to take on board. So recognize and appreciate that faith is important for others. I just wanted to share with you something that Donald McCaskill, who's the chief exec of Scottish Care, wrote at the beginning of one of the cameo series that Scottish Care produces. And this one was on the theme of spiritual care, which we wrote. But I think it sums up a lot, and I hope imbues that kind of sense of feeling that we need to think about. So he stated, spirituality has to do with the heart and pulse of being human. It is the soundless language which communicates our deepest emotions of love, anger, fear, and belonging. It is the rhythm which gives form to many of our innermost thoughts and feelings. It is a space where we rest in the awareness of meaning beyond comprehension and experience beyond description. To offer spiritual care is to give opportunity, time, and place to enable an individual to explore and to express who they are as a human individual. As we seek to embed a human rights-based approach to care and support through the new national care standards, it's important that we not only understand the role of formal religion and belief systems, but wider understandings of spirituality. As a care sector and as carers, we need continuously to explore what this may mean for our work and for the services we offer. I think that really, for me, encapsulates what we are trying to achieve. And it also emphasizes how important the human rights element is, together with rights and responsibilities. Next slide, please. So we're looking at spiritual care in a policy context. It will be different in different countries throughout the, in different parts of the UK, as well as, if we have visitors and people on the webinar from the States, there will be a different way of looking at things perhaps. But the Scottish Government has made it absolutely fundamental to all the policies that they produce that there's a human rights emphasis on it. And as we can see, you know, the WHO is very clear on its stance, and the national care standards are very clear about where faith, belief and spiritual care lie, and the importance of them being enabled in different care situations. Within the NHS, there's a fully acknowledged chaplaincy, spiritual care team in each health board. And that's embedded, and we would like it to be bigger, but it's clearly there and plays a really important part. In hospices, which are largely independent, again, there's a chaplaincy which supports spiritual care. In care homes, it's not the same, because so many different organizations operate with running care homes as different management, they're different owners and so on. So a structured chaplaincy is not, well, it's not deemed to be possible at the moment, but we never know for the future with integration of health and social care. But care homes staff do enable services from faith communities to be held in care homes for the benefit of residents, and that is very important. But it doesn't provide that more personalized approach that chaplaincy can do. So it's very important. So when you look at these policies and these systems, how do you feel about how well they're implemented, and what is it we could do more about? So to follow through on the policy issues, next slide, please. So the World Health Organization in publishing this is quite clear about that care should embrace faith and hope. And there's a lot of research that's been done about how patients are sustained and often get better more easily if they have that kind of external element to focus on. So it is really important. But it's about a holistic approach. And that's what we need to look at. So it's not just the physical, it's not just the emotional, it's this combination of those cornerstones and those values, and how do we embrace them and how do we embed them in the work that we do. So importantly, how do we attach the same values to the way we support staff? And I think everyone would recognize that the pressures on staff have been incredible because of the pandemic. But we always and must always consider how staff are impacted when they're providing care throughout, whether it's acute care or end-of-life care, how they're impacted by that. And Scottish Care wrote a report called Trees That Bend in the Wind, which absolutely points this out. And I make no apology for quoting from different reports that actually pull up these elements and may well be recognised by any of you. So this is a small paragraph from it. The individual and cumulative impact of these losses, it's particularly around death and dying, and very appropriate at the moment, increases staff absence and harms retention. Just as spiritual care is important in the care of individuals, so it is for staff, who must be supported when their work embraces end-of-life care, dying and death, and the demands of a stressful environment. The Scottish Care report, Trees That Bend in the Wind, highlights the role played by staff in considering someone's end-of-life issues and in triggering those important conversations. But this staff role has to be recognised, nurtured and valued. A greater understanding of the spiritual dimension can help to increase confidence in these conversations, which include religion, but acknowledges that it is so much wider. So it's really important we look at these values, but we also look at that interdependence of those factors. And also that it's very individual. Next slide, please. I just wanted to use this as an illustration. Next slide, please. Thank you. This is taken from the palliative care delivery plan, which is now, I think, about 2, maybe even 3 years old, but it quite clearly focuses on physical, social, psychological, and spiritual, those factors which in the care of people makes that whole for us. And I suppose we need to be watchful that we don't only think about spiritual care as being embraced in palliative care. Spiritual care is across the board, whether it's acute care or whether it's end-of-life care. It's a really important element. It's making sure that we are aware of what makes somebody tick, that it's part of who we are and its identity. And it's not all about when we are ill. It is about how we live our lives generally. But I think sometimes the association of spiritual and religion gets tagged on to the end of life matters. And I would really counsel that it's got a much wider approach. So when we're looking at it, for some, the spiritual aspect might be a quiet corner for contemplation and resolution. And for others, it's the enjoyment of seasons in nature, the love of family or friends. And I think we've all seen how people's spirits, their emotional lives, their psychological well-being are all diminished at the moment for the lack of contact with those that they love. And we need to look at how all those factors contribute to renewal for the future. And music. And I just illustrate that, you know, if somebody chose music for me and played me country and western music, that would definitely not raise my spirits. And no offense meant to anyone who loves it, but it wouldn't be my choice. And it's really important that we do consider it's not just the music, it's not just the nature, it's about how that person relates to those things. And that comes out of stories. And I know I talk about stories a lot, but it's one of the things I've certainly learned over the last few years doing this work. Next slide, please. Just to go back to the human rights aspect, because I think it embeds what we've been trying to say. It's about implementation, though. We can have all the rights in the world written down on paper, but it's actually what do we do with them in practice? And so I think that that's something that we really do need to focus on. We need to understand where spiritual care fits and that it is part of the whole of caring for people and for people's well-being. So that's why we're asked to do it. But I think we need to say is, why is it important that we should do it? And what can I do in practice to make it happen? So next slide, please. So over the years, we've done quite a lot of research. We've done a lot of training for different groups. And I think fundamental to it all is how important it is to understand ourselves. We have an online course called Spiritual Care Matters, and we started it with a view to supporting residents. And when we had a group of nurses looking at it, their comment was, we need a course to help us to understand ourselves. So we developed that, and it is on our website. So that's, if you like, a really fundamental plank that we need to look at. I absolutely must acknowledge that health and social care staff provide spiritual care very often quite unconsciously. The way they do tasks and the tasks that they do that promote well-being in the round are spiritual tasks. The friendship they offer is a spiritual task. and the support that they offer in these really, really terrible times is absolutely a spiritual task. But all the sort of courses we've done, but one of the key things is, and we just alluded to it, is that language can be a barrier, and that we need to come back and have a look at that. And we've just completed a research project in Scottish universities, and there is this gap in the language that's used in the classroom and the language that one might use on the wards or in a care home. And it can be disempowering if we don't get it right. And I will come back more to that. But we found that the term spiritual care was often used much more in mental health training or in palliative care training than it was in the sort of general training for all nurses. So the role is absolutely, the role and language and the way we do tasks is absolutely integral to our sense of well-being. Next slide, please. Just wanted to reflect, this is a quote from a staff member from one of the care homes we did some research in a couple of years ago. The question for us is, how do we manage to instill that understanding, that perception of what spiritual care is about throughout the staff team, whether it's the senior nurse or whether it's a care worker or the cook. Everybody has a contribution to make. And what came out of this research